Happening right now, tens of thousands of Kaiser nurses and healthcare workers are on strike at hundreds of clinics across our state and Hawaii. The union representing employees says they're striking over unfair labor practices, while Kaiser says it's about wages. ABC 10's Austin Castro went to Kaiser Roseville, one of the picketing locations this morning, and he files this latest report.
Kaiser and the union representing healthcare workers have been in bargaining talks for several months now, all of it surrounding a possible agreement with contracts. Now, across California and Hawaii on Monday morning have been strikes surrounding those talks, including right here in Roseville. Just take a look. Many of the people out here have been out here since 7 a.m. and it's only grown throughout the morning. I would estimate now about 200 people, many of them holding signs with their messaging, including the hospital is on strike. Now, all of this as both sides try to find common ground amid the discussions. Patient care and safe staffing levels. That's what healthcare workers on the picket lines Monday morning say is at stake with their ongoing bargaining talks.
We're fighting for fair wages for our employees. We are looking to have benefits for our new affiliates. We're all standing together as one.
Speech language pathologist Kurt Hankins is one of the hundreds striking at Kaiser's Roseville Medical Center, calling for change. Wages are just one of the several key points they're fighting for. In a statement released Sunday, Kaiser says in part, quote, "This open-ended strike by UNAC UHCP is unnecessary when such a generous offer is on the table. The strike is designed to disrupt the lives of our patients, the very people we are all here to serve." Kaiser maintained they proposed their strongest national bargaining offer with a 21.5% wage increase over the 4 years of the contract. Still, workers argue it's also about more than just money. Many we spoke with say they feel they don't have the staffing or resources to continue delivering quality health care.
And so those of us that are remaining are working longer hours because of our long hours, long call, nights, weekends, our quality of life has shifted and people are experiencing burnout.
Kaiser tells us they dispute union claims about staffing. They say they meet or exceed all staffing or safety requirements, in addition to an 8% turnover rate, lower than the 20% industry average. As for how this strike could impact patients and members at Kaiser, Kaiser said their hospitals and most of their facilities will remain open. However, they've also said that in some cases, they've had to reschedule or shift to virtual care for some of their appointments. Of course, as an open-ended strike, this could last for as long as needed in order to reach an agreement. In Roseville, Austin Castro, ABC 10.